the profile of today's speakers. And I'm starting with Bernice Adehe, who is a pediatric nurse, a passionate and dedicated pediatric nurse at the Pentecost Hospital, Medina, with over 12 years of experience in maternal and child care, experience in delivering exceptional care to patients and their families, nurse in charge of the pediatric ward at the Pentecost Hospital, and skilled certified pediatric nurse with expertise in child care and nurse education. Best in collaborating with other team members to ensure that children and their families receive the highest level of care possible. Graduated from Legon as a pediatric nurse and did health science education and a BSc nursing at University of Cape Coast. As for our second speaker, who is in the person of Cynthia Asantewaa Asante, a registered general nurse at Pentecost Hospital with experience in the care to patients and their families, a professional with more than 10 years of practice in emergency, medical, surgical, and pediatric care. Hardworking, competent, and reliable individual who is up to new challenge in care delivery. Excellent in working with others to improve on patient care. Privileged to work with other staff in committees such as quality improvement, infection prevention and control, data validation, and internal standard safe care to improve on patient care delivery. With a BSc nursing at Central University and currently pursuing pediatric nursing at one of the prestigious institutions in the country. Rotarian President, that is the profile of our two speakers, and if you allow me, the floor is theirs.
Well, over to you, speakers.
Thank you very much. Thank you very much. Good evening once again.
Good evening.
I hope I'm being heard. Am I being heard?
Loud and clear.
Okay, thank you. So, as our previous host said, I'm Cynthia Asantewaa Asante, and I'll be co-facilitating this presentation with my boss, my able boss, Mrs. Bernice Adehe. So I will give me a few minutes to share my screen. Okay. Please, can everyone see my screen?
Yes, it's very clear.
Okay.
I see some toddlers on the screen.
Yes, toddlers. That's about children. They are mysterious human beings. They are so nice to be with. Okay, so our topic for presentation today is developmental milestones and screen time in children. We can attest to the fact that it's not just you taking your child to the child welfare clinic. Some people will say weighing, where they check the child's weight and what's the name, heights. Then that is all. It entails a lot. It entails this child's development. We'll go much into details what that is. And screen time, as we can all see, most of us are always behind our screens. And our children, our future generations, they are learning from that. So we'll go much into details later on. I hope the network is favorable enough for me to make this presentation. So without wasting much time, I'll go on to our learning objectives. So at the end of this presentation, we should be able to define what developmental milestones are, to be able to identify the domains of developmental milestones. Also, we should be able to identify some various developmental milestones to achieve at each age. Then also to describe some risk factors that affect development, to identify some factors that prevent developmental delay, describe some tips in parenting, describe some benefits of play to the child, and describe screen time and its impact on our children. So that's our objective for today, and hope we'll achieve that. So for our agenda, we'll start with let's get thinking. Then we'll start with developmental milestones. We'll move on to the domains of developmental milestones and various developmental milestones to achieve at each age, the risk factors, how to prevent these developmental milestones, some tips in parenting. We have some videos in between as I present. And we'll talk about play, screen time, and some questions and contributions. I hope this session will be interactive so that we'll learn from each other, because I know some of us are parents, some are aunties, some are uncles, some are grandparents, and others know one child one way or the other. So that's our agenda. So we'll start with let's get thinking. So I just want maybe one person or two people to kindly, what's the name, answer these questions on the screen for us. Why do we play? And what are some of the importance of play? Can anyone help us with that? I'm sure we're all children at one point in time, and we played. So can anyone help us with that? See, this is where we get interactive. My abled Rotarians. Okay, Sister Esther, please. The floor is yours.
So we play to have fun, to get to interact with other people, and just get distracted for some time. Then what are some of the importance of play? I think when we play, we forget some of our worries, we get to enjoy our time and be happy.
Thank you very much. That is so. I could just sense that she was there reminiscing when she was young. That is good. Is anyone else? Okay, Sister Jima Labi. Okay, the floor is yours.
Okay, so I just asked my children, why do you play?
Okay.
And one said, I play because I feel like playing.
Wow.
Wow. And the other said, I play to have fun.
Okay.
For me, I say, I play to relax.
Relax. Okay.
Yeah.
Thank you very much for your contribution. I think the children have answered our question. They play to have fun. Yes.
Madam Speaker, there are two comments in the chat box on why we play.
There are two comments. Okay, yeah, please can you read it out?
Okay. Joe says to relax and to learn social skills.
Okay.
And Ado says we learn through playing. Thank you.
Okay. Thank you very much. I think most of you know the topics. I think we can bring the meeting to a close, because I think, yes, most of you have the idea of what we are come to talk about. So this is just a refresher of the things we have forgotten and to bring them back. As she said, as the adult said, she plays what? Relax. So the importance of this play to the children, both the child and to what? The adults. Thank you very much for your contribution. So I think we can move on from that. So let's have this at the back of our mind. And I think one person will be asking, or two or more people will be asking, what is all this play and this topic about developmental milestones? As we go on, we will know how this two interacts with each other, as well as the screen time. So thank you for your contribution. We'll move on. Okay, so So we'll define what developmental milestones are. So developmental milestones are behaviors or physical skills seen in infants and children as they grow and develop. As I said from the beginning, it's not when you just deliver and you take your child to the CWC, that is the weighing, people will say, and they just check the child's weight and the height, and they say your child is growing well in height and weight, then that is all. No, development is also part of the growth. And we develop in our behaviors, in our physical skills, how a child is supposed to what? Able to button the shirt, supposed to tie the shoelace. All these are skills that these children pick up when they are developing bit by bit. So we say developmental milestones are behaviors or physical skills seen in infants and children as they grow and develop. So as we go on, we delve into details about that. It can also be defined as the sorts of goals or markers that a child is expected to achieve during maturation. So as a child is growing at 1 year, what is this child supposed to be doing? At 2 years, what is this child supposed to be doing? So a set of markers, you know that when you hit this are the things this child is supposed to achieve. When you hit this age, this is what this child is supposed to achieve. So that when this child is not actually hitting these markers, you know that there is a problem and you need to actually seek a professional help. So that is the definition of developmental milestones. I hope it was well explained. Then we'll go on to the domains of developmental milestones. So developmental milestones, as I said, is a broad topic. It's not just about you growing weight and height. It's also about you growing physically, emotionally, socially, cognitively. So these are the domains. These are the things you see in a child to see that this child is growing well developmentally. So with the domains, we have one, the gross motor skills. So these gross motor skills has to do with the involvement of the muscles, the whole body, the large muscle involvement of the whole body. Example, we have what? Crawling, walking, running, sitting, jumping. Those are examples of these gross motor, development skills. Then we also have what? The second one is the fine motor and what? Vision. The fine motor has to do with the skills involving the smaller muscles. So example, when a child grabs onto something with just the hands, then when a child is able to draw, when a child transfer one object from one hand to the other, those are some of the fine motor skills. And the vision has to do with the sight, child being able to see, be able to follow an object when it's taken to one side of the head and the other side, vice versa. And the speech, language, and hearing has to do with the skills of communication with each other. Children grow through our communication with them. Our communication with them, not communication on the screen. Let me state again, communication with them. So when we communicate with them, this is where they form sounds and they form their words and their language, which is very, very important. So children grow through this, their speech, language, and hearing. Then the last one too has to do with the social and emotional and behavioral. That has to do with their interactions with people. Children learn this from us. They grow in their social skills. They learn how to behave towards people, towards other children. And they also learn how to express themselves, their emotions, and also behavioral. They know these are the things that are acceptable behaviors. We don't do this in the open, we do this at home and all that. So they learn all these things through their development. So we'll go much into details each by each to make it more exemplary for us. So with the gross motor skills, you see with the first picture, a newborn is supposed to what? A newborn who is delivered today, a baby who is delivered today, is supposed to be what? Flex, well flexed. You see where both hands and feet are. They are flexed like a frog. Excuse my word. When you look at the frog, you see how the frog's legs and the legs are. That's how a newborn is supposed to be. And at this stage, the child will also have what? A marked head lag on pulling. When you pull the child up, the child is lying there, you pull the child up with both hands, you see the head gone back. So there's no marked head control during this stage as well. And this marked head lag normally disappear when these children are normally 3 to 4 months of age. And at 6 to 8 weeks, babies or children are supposed to be able to raise their head 45 degrees in prone. When you put a baby on the tummy, this baby is supposed to raise the head a little bit, not all the way up into the sky, but raise the head a little bit, as you can see the child in the photo. Then at 6 to 8 months, this child is supposed to sit without support. So particularly at 6 months, this child will be able to sit, but will have a round back. That is at 6 months. But at 8 months, this child will sit with the back straight. Yes. Then at 8 to 9 months, children would crawl. We will say that some children don't normally crawl. Some just start, walking. So it's developmental milestones, I'll say it differs in all children. So it's good for us to know these milestones, but it's not good for you to be comparing your children with others because every child is unique. Yes. Then we also have at 10 months, these children are able to cruise around furniture. So when they are involving their large muscles, their whole body, cruise around furniture. As you can see, the child holding the table. So can hold the table and will be cruising around it. And at 12 months, this child is supposed to be walk, but unsteadily. So the child is walking, but you can see this child is shaking a little bit. But at 15 months, this child is able to walk steadily. So this one, they just walk and they're just going. There's no shaking on anything attached to that. So those are the gross motor skills. Then we'll move on to the second domain, which has to do with what's the name? The second domain has to do with the vision and the fine motor skills. So at 6 weeks, children are supposed to be able to follow moving objects or face from turning the head. So when you place an object at the right side of the head, this child is supposed to be able to turn and follow. Then also, sorry, I think I went ahead of time. Then you see at the other side too, children are supposed to reach out for toys. Yes, reach out for toys. These involve their fine skills, involving their upper limbs. And 4 to 6 months, palmar grabs, when children are able to grab onto things. This is a primitive, reflex. It involves movement of the, of the hands. You could see the child grabbing onto the cube in the hand like that. We are all born with that. Normally, when you put your one of your fingers in a baby's hand, you could see the baby grab onto that. And normally this, you can see them grabbing onto our hairs, onto our screw. When a baby pulls your hair or a child pulls your hair, you pull your hair all the way down. That is the palmar grabs. And at 7 months, child is supposed to transfer a toy from one hand to the other. Then at 10 months, mature pincer grabs. This has to do with your ability to be able to use your forefinger or middle finger and your thumb together to pinch or to grasp onto an object. So in doing this, they get to learn the skills of buttoning the shirt, zipping and holding pencils. That is the pincer grip. Then at 16 to 18 months, children are supposed to make marks with crayons. At 14 months to 4 years, to be specifically at 18 months, children are supposed to form 3 towers. You see the breaks down, they form 3 towers. So it is expected for a child during 18 months to form these bricks. Then at 2 years, to be able to form 6 bricks. At 2.5 years, form 8 or train with 4 bricks. Then at 3 years, form a bridge with this bricks as well. And at 4 years, form steps with these bricks. And at 2 to 5 years, child is supposed to be able to draw a line. 3 years, draw a circle. 3.5 years, draw a cross. And 4 years will be able to draw a square. And 5 years able to draw a rectangle. So those are the fine motor skills and the vision. Then we'll move on to the third domain, that's the social, emotional, and what's behavioral. No, sorry, this is the hearing, speech, and what's language. So with a newborn, a baby is supposed to be startled when there is noise. Some mothers will say, that is a startling reflex. That's a normal reflex for a baby. You're supposed to see that in your newborn. And also should be able to vocalize alone when spoken to coos and laugh. This is where they start making some noises you yourself, you cannot comprehend or understand. They are forming their language and understanding by interacting with us. At 7 months, they are supposed to turn to soft sounds out of sight. So when there's a sound at the back, you see the baby was turning to that particular sound. At 7 to 10 months, at 7 months actually, they are supposed to make sounds and use them indiscriminately. So they can say words like dada mama, but they will say a mother and say that the mother is the father, dada, and the other way around as well. But at 10 months, they are able to discriminate between their parents, know that this is the father and this is the mother. And at 12 months, they form 3 words other than the dada mama. Then at 18 months, they form 6 to 10 words. They can show you where the part of the body is if they are being taught. Then at 20 to 24 months, they use 2 or more words to make simple phrases. Yes, like the example in the picture, give me 3, what's the name? Simple words to make a phrase. Then at 2.5 to 3 years, they normally talk constantly in 3 to 4 sentences as shown in the picture. So that is the third domain, hearing, speech, and language. Then we go on to the large domain, which has to do with social, emotional, and behavior. Our children grow socially, emotionally, and behaviorally. So at 6 weeks, they smile responsively. So when you smile to your child is supposed to smile back to you. That's why we need to interact with our newborns, our children, and all that. Then they put food in their mouth at this stage. At 10 to 12 months, they wave bye-bye mama, play peekaboo. Then at 12 months, they are supposed to be able to drink from a cup with 2 hands. At 18 months, they hold spoons and get food safely to their mouth. At 18 to 24 months, they are able to play symbolically. That's symbolic play. If we remember when we were children and we want to imitate our mothers, we go for these tin tomatoes cans. Then we go and we pick some stones and we say we want to cook. That is symbolic play. We are just trying to emulate whatever we've seen onto something. A child will want to have a ball, play with a ball, but doesn't have. But I'll pick pieces of papers together and get a sellotape, wrap it around it. That is a ball for the child. And a child can pick a banana and put it on the ears and say, hello, that is the phone for the child. That is symbolic play. So they normally do that during that stage. And at 2 years, they're able to pull off some clothing. At 2.5 to 3 years, they do parallel play. And parallel play has to do with they are playing, but they are playing differently. There are a lot of children in the room, but this child is playing this particular play. The other child is playing this particular play. It helps them share with each other. They learn to interact and share with each other when they do this parallel play, and also brings up creativity in them. So those are the domains of development and what's the name, children. So apart from the weight and height that we go for, children grow in this stage as well. So we watched a short video to actually summarize what I've just said. I hope we can hear.
Monthly baby milestones. Your children may be able to start crawling on his or her 6th month of age, but others may not even be able to roll over from their tummy yet. The development stages of every child are different, but theoretically, babies will follow these milestones throughout their first year of life at their own pace. 1-month-old baby milestones. Notices faces, sees bold patterns, especially in black and white, recognizes the sound of your voice, starts to coo and make sounds beyond a simple cry, brings his hands within range of his eyes and mouth, moves his head side to side when lying on his stomach. 2-month-old baby milestones. Starts to recognize people at a distance and smile. Begins to follow things with eyes. Briefly calms herself. May bring her hands to her mouth to self-soothe. Begins to get fussy and acts bored if the activity doesn't change. Holds her head up. Begins to push up when lying on her tummy. Makes smoother movements with her arms and legs. 3-month-old baby milestones. Can distinguish your face from others. Starts to have different cries for different needs. Hunger, diaper change, pain. Opens and shuts hands. Turns his head away to express boredom. Swipes at dangling objects. Follows moving objects with his eyes. Turns his head in the direction of sounds. Enjoys playing with other people and may cry when the playing stops. 4-month-old baby milestones. Starts to giggle and laugh. Copies facial expressions. Reaches for a toy with one hand. Holds her head steady, unsupported. Pushes up onto her elbows when she's lying on her tummy. 5-month-old baby milestones. Rolls over from tummy to back. Explores toys by putting them in his mouth. Babbles. Loves to look at himself in a mirror. Entertains himself for short periods of time. 6-month-old baby milestones. Starts creeping along the floor. Starts sitting unaided. Passes things from one hand to the other. Starts to understand simple words. Responds to her name. 7-month-old baby milestones. Enjoys dropping things on the floor. Plays simple games like peekaboo. Begins to respond to no. Finds partially hidden objects. 8-month-old baby milestones. Begins crawling. Stands while holding on to something. Develops a pincer grasp using the thumb and index finger. 9-month-old baby milestones. May be wary of strangers and clings to familiar people. Has favorite toys. Makes a lot of different sounds like mama and ba 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 ba. Copies sounds and gestures of others. Uses fingers to point at things. 10-month-old baby milestones. Explores things in different ways, like shaking, banging and throwing. Pulls to stand. Starts cruising, shuffling along while holding onto furniture. Gets into a sitting position without help. Begins feeding herself finger food, thanks to better hand-eye coordination. 11-month-old baby milestones. Understands object permanence. Crawls up the stairs while supervised. Makes sounds with changes in tone. Sounds more like speech. Develops separation anxiety. 12-month-old baby milestones. Responds to simple spoken requests and directions. Uses basic gestures like shaking his head, no, or waving, bye-bye. Says mama and dada, and exclamations like uh-oh. Looks at the right image or object when it's named. Starts to use things correctly. For example, drinks from a cup or brushes his hair. May stand alone. May take a few steps without holding on.
Okay, thank you. I think that's it. Please, can I have one person to tell me what's you've heard so far? Any contribution, maybe anything you've learned, so that we can move on to the next one.
Fellow parents, since time is not very much on our side, can we have okay, so you are not done?
I'm done.
Okay.
I'm not done. I'm not done.
Okay, then finish
my
then
time up?
the questions and contributions.
Okay.
You have barely
Thank
5
you very
minutes
much.
to go.
Okay, so we'll move on to play. As we said, children reach milestones and how they play and interact. As we said, we didn't see any screens in our previous videos or presentation. So children benefit from play. They learn their motor skills, their balance. They get stronger muscles, which help them prevent obesity as well. They develop emotionally, socially, and cognitively and behaviorally. Then these are some of the benefits of play. I think time is not on our side, so we'll move on. So for some risk factors for developmental, delay, we have head trauma, pregnancy-related complications. We have environmental toxins like lead and arsenic and mercury. We have prenatal infections like HIV, rubella, toxoplasmosis, prenatal toxin exposure. We have smoking, alcohol and drugs. We have nutritional deficiencies and maternal chronic illnesses like DEM and the others. So to prevent that, we are supposed to be go for our A and C. That's when we'll be able to identify some problems and solve them. And we are supposed to also take supplements we are being given during our pregnancy. Then also we should supposed to talk to our doctor when you are taking any medication. And we also go for screening during our prenatal period. Then we also have to avoid smoking, alcohol, and drugs as well. And for nutrition, a mother is supposed to actually eat very well to help the child to grow. And also we are supposed to go for maternal checks as well. So tips for parents, I think your co-facilitator will share with you. Since we don't have time on our side, I'll move on to screen time. You can see the child on the screen being frustrated because something is being taken away from the child. So a study by the National Institute of Health showed that kids who spend more than 2 hours a day on screen times score lower on language and thinking tests. Kids who spend more than 7 hours a day on screen show a thinning of their brain cortex, which manages critical thinking and reasoning. So this screen is doing to our children. And as a survey revealed that kids spend twice as long playing on screens as they do playing outside, which is very bad. And in 3 to 4 kids spend less than 60 minutes playing outside each day. And 1 in 5 kids don't play outside at all on a typical day. So the definition of screen time has to do with you spending much time watching your TV, working on a computer, or playing games in children. And children are supposed to limit screen time to 1 to 2 hours actually in a day. And what is expected of us is that at what age is screen time okay? According to the American Pediatric Association, screen time is supposed to start from 18 months onwards to 24 months with a parent or caregiver reinforcing lessons. And at 2 to 3 years, screen time is supposed to be up to just 1 hour a day, which is supposed to be even for high quality program education, not just anything. I think we will go on this. So the impact of screen time on our children, we have obesity because you have a child sitting behind the screen all the time. There's no physical activity. Sleep problems. They will end up watching these screens, the toys for a long period of time into the night, and they will not end up sleeping very well. Impaired academic performance, as I said, they have a thinning in their membrane, which affect their thinking and their reasoning. So they don't actually do well in schools. And with the screen time, so the impact is on chronic neck and back problems. So much time holding and bending your neck and watching the screen. And we also have depression because during this screen time, they don't interact with anybody. There is no social interaction. We also have anxiety. We have lower test scores in children, as I said, and violence as well. Then we have less time to play. Yes, they don't play because they like watching their tablets and playing games. And there's increased eye strain on the eyes as well. Then we have pain in their hands, fingers, and wrists from gaming or typing. They're always holding their tablets and their screens and all that. Then addiction to devices. Screen time normally increases the dopamine level. Constant screen time increases dopamine level in the body as the excitement we get from cocaine, smoking, and drinking. It increases our dopamine level. And addiction to these screens are always there. This is the kind of excitement that it gives to these children. Constant watching of the screens, it gives them joy, excitement. So they always want to go back to watch the screens rather than play among themselves. Then we also have some side effects, as I said. If you are not physically active, you are staying at one place all the time, you're at risk of developing cardiovascular disease, high blood pressure later on in life, high cholesterol, and poor stress was regulation. So what do we do? Someone will ask, what do we do if we don't do screen time? We should play with our kids. We should do board games. We have other, where are our ludos, our oware, our skipping rope, all those are games. We need to bring them back. And we are supposed to also do some arts and crafts. Involve your children in these things so that they will take their minds off the screen. And story time is best to use the book than the what's the name? The screen. Then drawing and coloring. Then making cookies or healthy or snacks. I think time is not on our side. So at the long of it all, play is important in every child's development, as I said, because with play, you develop the child physically, socially, emotionally, cognitively, and all that. So I think I'll bring my session to a close. Please, any questions are welcome for more explanation. I like to talk a lot, so that's why I was sorry for that.
Thank you very much, Ms. Cynthia Asantewaa Asante, for this very thoughtful presentation. Fellow Rotarians, I want to, if there are any questions, comments, or contributions, now be the time to let us have it. Fellow Rotarians, partners in service, any questions, comments, or contributions, please? If you are driving and you can type your question, you could leave it in the chat box. And okay, so I have a comment here. So we so learn when we play. We so learn when we play. Okay. Any questions, comments, or contributions, please, fellow Rotarians?
Abi, quick one question, please.
Yes, Rotarian Chair.
Abi, she didn't talk anything about hair growth. Hair
growth.
Yes. In the babies. I didn't hear anything on that. Where
Are you talking about the hair
yes.
on our
Yes.
head?
Yes.
Okay. The hair on our head.
Some mothers are forced to start creating their daughter's hair at tender ages and stuff like that. I don't know whether there are side effects or it is allowed. And some babies come with that hair. When do we start to expect hair on their head? And some other traditions, they have to scrape their baby's hair, sakura. I don't know whether there are any side effects or you do have any research on all these things. Thank you.
Okay, thank you very much, Ambrose. Madam Cynthia, I have a question too. For some babies, okay, when you go to church and you are trying to get them to keep quiet, the only option left for some of we the parents will be maybe open YouTube ABCD video for him or her so that you can have her attention. In such cases, what do you do? Because you're in a church and you can't be escaping or you can't be engaging in any of the activities, but just to open something for him or her to, in quotes, learn something whilst you're in church. What would you advise in such instances? Thank you.
Okay, thank you very much. So I think I'll answer the question from the second one about children in churches. As I always say, children are wonderful human beings. You see, when they reach churches, that's when they get to see other children. Play is, how should I say, inherent for children. Children are born to play. So when they are being given the opportunity, the least opportunity, then they can just let it go and express themselves. So for me, from what I'm seeing, it could be the children don't actually get the time to actually play much at home. So when they get to these settings where they meet their peers and are able to, express themselves and all that, that is when they get a chance to actually play. So I wouldn't say you should restrict a child from playing, but I'm sure some churches have places normally for these children where you leave your child to them and they will actually see your child whilst you go for, what's the name, church. I think we need to pick it from there at home. We need to let them play as much as they can, so that at least when they go to these social gatherings, they will be a little bit taken reserved. Know that this is a social gathering where everybody is seeing, so I need to behave well. Please, I hope my answer is quite it's very answerable. Yeah. I don't know whether my able in charge will want to add on. Sister Bernice, would you want to add on to that?
Yes, I want to say something. Okay. Thank you very much, Cynthia, for the presentation. My people, I'm very sorry, I'm out of Accra, so I'm a little distracted. That's why I've not been able to really feature in this. But Sister Cynthia, thank you so much. All she's saying is very passionate to us, especially the screen time. What we have realized is most parents, or these days, aunties, grandparents, everybody is giving their children, grandchildren, nephews and nieces, tablets and phones to play with, where they think it's now that's the fashion of the day. People are doing it, so everybody, is also doing it. Well, we are saying that children can have time for screen. That is what we call screen time. But then it has to be limited. You see, so a child should get 30 minutes to 1 hour screen time. And of course, as she said, it should be educational. So when you go to church and then this child is worrying you, you just want to give the phone to the child so that you sit somewhere and then you listen to the sermon or whatever goes on at church. You also have to bear in mind that this child is out there to play. So if you can actually excuse yourself a little, or as she rightly said, my church, for instance, we have Sunday school, which is separated from the main church. We have teachers there who are able to handle these children. So they are very much separated from the adult church. So they go there and then they do all their play there. I'll go for my kid and they will say, hey, Auntie Bernice, the lad can really play around. He'll be jumping and all. Yes, allow him to do that. This is not the time for screen. This is the time to play. So when you go to church, please separate them as much as you can. If you think you can't separate them, and then go and stay out with them. Are supposed to have it protects them from the weather. So sometimes you see newborn babies, we wear them cap. Most of the time, people can even wear cap for a longer time for children. Yes, it's good. It protects them. So the hair on their head protects them from the weather. It gives them some sort of warmth. Yes. Some mothers would also want to plait it and then dress the children with it. It's okay. But adding chemicals to it will not really help the children. But let's keep it on for a while, not to cut it early, just to protect the children and again, give them some form of warmth. Thank you very much.
Thank you very much, Madam. I'll take the last question before I take the vote of thanks from PHRJO. So I received, this question was sent to me in a private chat box. Please, can you ask about hand sucking and how we can prevent that? Children who suck their hands and how they can be prevented. I'm not sure it has anything to do with screen time, but since it's your field as a pediatric
Can you come again? I didn't really hear the question. Children
who suck their hands.
Okay. That's fine. Okay, so this thing, well, you see, when you deliver a baby initially, it is not the baby's fault. When you deliver a baby initially and then they break where the mother has not had a chance to breastfeed, most of us these days go for cesarean section instead of the normal delivery. So you see, when a mother delivers, it takes a while before the mother is able to breastfeed the child. So between this period and the time the mother will be able to breastfeed, the child is hungry. So he stretches the hand and then the hands go straight into the mouth. That is it. It is very, very, very difficult to pull this child or stop the child from sucking. So the child can suck for a while. People try a lot of things so that these children can stop sucking. There's nothing you can actually do about it. They grow out of it. So as they grow, they stop. But what you can also do is to help them with hand washing, periodic hand washing. If you are able to wash your child's hands very well, you know children play in the ground, the soil and all that. So if you're able to monitor the hand washing or the hygiene of the child, it helps a lot. These children, most of the time, come with a lot of infections, which do not help, but you can't also stop them from sucking because it has been established from childbirth. It is very difficult, and then they grow out of it. We are not done with you. I know things are very interesting. So we'll leave our numbers with your bosses, and then anytime you want to reach out to us, you can. You can call us, you can WhatsApp us, you can text us. We are always available. Thank you very much.
Thank you very much, Mrs. Bernice, Akua, Adiki, Adehe, and Miss Cynthia, Asantewaa, Asante. From the chat box, we have informative and educative PowerPoint presentation from PHRJO. Nana Ajiman Mensa from one of our sister Rotary clubs indicates that great presentation, thanks. On this note, we would invite PHRJO to give us the vote of thanks, and the fellow Rotarians will crave your indulgence for some 10 more minutes so we can wrap up the rest of the activities that we have. PHRJO, kindly give us the vote of thanks, please.
Thank you very much. Good evening, Rotarian President, fellow Rotarians, contractors, and guests. On behalf of the Rotary Club of Accra East, I would like to express our appreciation to you both, to Cynthia, and then also to Bernice, for this very informative and educative talk. Lots of insights. We are grateful, and then we hope that you'd continue to educate our mothers and our fathers and caregivers, particularly on how best for the development of our children and grandchildren. So we thank you and hope that you do come back again and again and eventually also become Rotarians. So once again, thank you all very much. And this would be shared with you so that you can hang it up in your office. And we also hope that everything that you've told us this evening abides by the 4-way test. And we are grateful for that. So thank you and stay blessed. Over,
Thank you,
President.
Thank you very much.
Thank you very much, Madam Cynthia, Madam Bernice. You can stay on until the next